Seems to be all the craze nowadays, from online fitness trends even all the way to the White House. President Trump signed a bill last week to put whole milk back on the menu in school cafeterias. Now, parents are weighing the potential pros and cons it has on their kids.
But is whole milk healthy for kids? Here to explain all the impacts is our medical expert, Dr. Payal Kohli.
Hi, ladies.
Hi, thank you for being here, because I've been seeing people talking about this left and right, almost debating on my social media.
And what are you having your kids drink?
I mean, my daughter still drinks milk, so
Yeah.
she drinks whole milk every
milk?
single day.
Yeah, good.
Yeah.
And we drink plant-based milk, but some of the plant-based milks that I get, the ingredient lists are like this long.
Yes.
And so there's a brand,
Very
I
good
don't want to tout any certain brands out there, but there's
Yeah.
a brand where there's only 3 ingredients. So I've been going with that one.
Which plant-based
Malt.
milk?
Oh,
Like soy or
it's
almond,
oat, but it's
Oat.
the brand is, I might as well just say it, malt, but there's no advertisement attached to that. Or malk, M-A-L-K, but only a few ingredients compared to a laundry list of them. That's
This is
important
very
to me.
confusing, but
Yeah.
let's
Yeah.
talk about it. So what's the difference between whole milk and low-fat milk? So there's 3 macronutrients, right? Fats, carbs, and protein. So the protein and carbs are the same. It's just the fat content and the calories. But it's not just the macronutrients, it's also the micronutrients that matter, right? So you're talking about your vitamins. Whole milk actually has more vitamins naturally than low-fat milk, because the process of taking the fat out removes the vitamins. Now they fortify it and put them back in there. But guess what? The vitamins don't absorb as well unless there's fat around, because 2 of these vitamins, vitamin A and vitamin D, are fat-soluble vitamins. So when you drink a cup of whole milk, not only does it give you more satiety, make you feel more full, obviously gives you more calories, but you're probably getting a little bit more vitamins per cup of milk than you are with low-fat milk. So it's a big decision when it comes to our kids who are growing.
Yes, but then my concern is we've always done whole milk, even with my first child who was like obsessed with it. And she drank so much whole milk, and she was a little roly-poly. She was so cute, but she was very round. She was in like the 98th percentile of weight and height, 'cause she's always been tall.
Yeah.
When I tell you we stopped that milk within 3 months, she was
It went
like,
away.
it went away. She's like this
Yeah.
big. Now she's like 64%. But I don't know if that's a direct correlation, but
That's
I mean,
interesting.
she was getting some of
Yeah.
that fat from that milk for
So
sure.
when they're under 2 years old, they have to drink whole milk, because 30 to 40% of their calories need to come from fat. Their brain is developing. So a 2-year-old has 80 to 90% an adult-sized brain, but it feeds on milk. It feeds also on fish oils and other things like DHA and EPA, but you want to give them whole milk up until then. Now, most pediatricians will say at 2, you want to switch to low fat, especially if you've got a roly-poly on your
Yes,
hands.
little roly-poly. I miss it so much though. She was so cute.
No, they're the best.
But they're so round and like
She's
she was
still very
round and
cute.
skinny. Yes,
but,
yes.
but that's a lot of calories. But
Yes.
here's the problem. We don't actually have data that tells us that whole milk is associated with more childhood obesity. In fact, there's some that argue that because it gives you more satiety, you end up snacking less. So to me, I'm not against whole milk even for kids past the age of 2, but it needs to be in moderation, because if you drink too much milk, you can actually create an iron deficiency. And there's 2 ways that that happens. One, of course, milk doesn't have a lot of iron, so you're not eating as many other foods, especially as a kid when you're drinking a lot of milk. And 2, it actually can prevent the absorption of iron. The calcium in the milk can prevent absorption of iron in the gut. So you want to limit your child to no more than 24 ounces, which is 2 to 3 cups of milk, whether it's whole or low fat.
So, okay, now I'm even more confused.
I know.
It's so confusing.
Yeah.
So what would you recommend parents watching right now? Should their kids do low fat, let's say 2 and older, low fat or whole?
So I think it's personalized. And this is
Okay.
what I like about bringing whole milk back into schools. It's not a one-size-fits-all. Because if you've got a roly-poly who's getting too many calories and maybe on the higher end of the growth curve, then you probably need to push them more towards low-fat milk. On the other hand, you have kids with eating disorders. You have kids who are obsessively concerned with how many calories they're taking in, or those that are not growing. They may actually need that whole milk in order to supplement. So I really like the idea of having all the different milks in school. Now, what you definitely don't want is sugar-added milk, because that's a no-no. Whether it's whole or low fat, you do not want sugar added. And Sam, you had mentioned plant-based milks. That's something we tend to avoid in kids in general, unless they're allergic or they have a problem with lactose. And then only you want to use soy, fortified soy, or pea, because the oat and the almond and what have you don't have enough protein for our kids. Now, it's different for adults, of course. But when it comes to kids, I think having more choices of milk is beneficial. I think talking to your pediatrician about whether they need to switch to low fat or they can stay with whole, or perhaps even alternate, because again, the vitamin content of whole milk is a little bit better. But to me, this is not necessarily a step in the wrong direction. I just worry that if everybody starts drinking whole milk all the time, that could be a problem. And we need to educate our kids about how to make healthy choices.
All right. Sounds good.
I know, personalized, right? That's important. Yeah. All right, Dr. Coley, thank you.